Hello, I'm here with my colleague Jess Rushing, Assistant Professor for Music Therapy at the University of Louisville. Jess, you are known for your work with internship supervision, and you recently published outcomes of your survey addressing what guides internship supervision. Yet your doctoral research is focusing on stroke patients. What is your research all about?
I became interested in neurorehabilitation side of stroke a few years ago, working in acute rehab setting. However, in the medical setting, I've noticed that a lot of stroke survivors are not ready for the more functional neurorehab approaches to techniques and music therapy. I became aware of the prevalence of post-stroke depression and its subsequent impact on survivors, as well as the body of music therapy research for acquired brain injuries that has looked at mood as an important construct, but rarely in the acute hospital setting and with several barriers to identify specific therapeutic ingredients.
What is important about developing research in this area?
A few things that are important to know about research in this area is that medication is the leading approach to treating post-stroke depression. However, non-pharmacological therapies show more promise in actually preventing post-stroke depression. Preferred music listening and active engagement in music therapy can have significant benefits across the recovery, with preliminary results from my research of active music therapy during acute hospitalization demonstrating significant improvements in mood in just one session. Additional findings will hopefully help us be able to tell more about the impacts of multiple sessions and clinical decision making.
What are the next steps in your research and the clinical implications?
The qualitative portions of my research are proving particularly interesting in relating to the next steps and implications for practice. They are illuminating the value of patients that find in therapeutic relationship, the value that the patients place on patient-preferred music therapy as a positive experience during hospitalization, and they highlight the development of clinical decision-making in a framework for music therapists to utilize when targeting mood elevation for this population and setting. Because mood is an idiosyncratic construct, such a framework is important to foster fidelity in treatment, to effectively modulate people's mood, and ultimately regulate emotion. My hopes are that we can build on the short-term findings to address post-stroke depression and in the long run, drive improved functional outcomes.
Thank you, Jess, for sharing your research with us.